and basically the health department, the way the program works, the health department screens the patients, and then there's a coordinator that makes that referral to the local dental providers. So the key is really the providers were on board.
Thanks, Jason.
Can I
Yes.
jump in? I think we'd be remiss to not acknowledge that the health department has an oral health coordinator, and so that was pretty key to, you can't do it without the dentist, but I think it helped them by providing somebody who kind of greased the wheels and made the system go. And that's a, I think that's something that you just need some people.
Richard, we got a trick question for you. This is like a questionnaire, West Virginia has met 7 of the 8 benchmarks. Which one has it not met?
Oh.
Am I allowed to help him?
Yes, sure.
The mid-level provider.
Here.
She didn't hear you. Oh. She didn't hear you say it. She didn't hear you say it.
No, go ahead.
Oh. The mid-level provider is one of those that we haven't missed. Or that we haven't.
Let's see, Bobby Joe. How did you get, this is the question, how did you get from the grade of F to a C?
The 3 policy benchmarks that brought us from an F to C, one was the increase in the school sealant programs, which the Appalachian Regional Commission and the Benedum Foundation helped to start, which was very critical. The other one was the increase in Medicaid reimbursement. And I think one that we have failed to mention thus far is the fluoride varnish program. And that's where we are actually, Medicaid and CHIP both are now reimbursing non-dental professionals to apply that preventive measure within the medical center setting. And for those of you that, when you think about it, a child sees the pediatrician or your family practitioner approximately 11 times by their, I think it's their first or third birthday or second birthday, where they've yet to see a dentist at all. So that's really critical, training those non-dental professionals to not just look and say, oh yeah, they have teeth and they have tonsils. Check, you check that little box. Actually assessing those children. So that was one of those benchmarks that's been really huge. And that initiative came with some funding from Benedum as well, and came through the school of dentistry. And there was some, Medicaid stepped up as well as West Virginia CHIP to make sure that those reimbursement rates were included, because we at the same time wanted to make sure that those medical providers were getting funding for that.
Thanks, Bobby Joe.
Hey, Margie.
Yeah.
I'd like to add, in terms of the sealant program, that a critical piece, an essential piece, was the partnership between Benedum and the Appalachian Regional Commission to support a program for getting screening done in high-risk schools, so that now in the most recent time period, 30% of the Title I schools in West Virginia now have a sealant program. And that's because of the initiative of those 2 agencies.
That's great.
Let me add one thing.
Sure.
I mean, F to a C, I think can directly be contributed to the willingness for, all the partners and collaborators, really to work together, agree to disagree, and find a compromise and basically move on. So, directly, I think our improvement is really could be directly contributed to the willingness of the partners to work together.
Thanks. I have a question for Sister Harrington. This is something that came up in our advisory committee, and you talked quite a bit about it, I recall, at that time, and that is, why hasn't support been given to the proposed law requiring children to have dental exams by 1st grade?
A lot of people in this room know that just because I don't know anything doesn't keep me from answering, but I'm going to try to be a little more reticent. I don't know, and I think it's one of those questions that we all have our answers, we all have our anecdotal things. What we probably don't have is a lot of really good data on that. So I don't know, but some of the things I've heard from the school perspective is that they seem to have a lot of mandates on them, but how is it enforceable? So do they turn students away at the door? So now they have oral health issues and they're not going to school on top of it. It seems to be going in the wrong direction. You know, I'm not connected to public schools. I'm not connected to health. So, you know, let me just wax on here. But I think it's well intended, and I don't know the detail, but I think it's one of those areas that we have a lot of myths and stories and anecdotal information, but do we have any really factual information that would tell us how to get around that? And is there a resource where if children show up, they can be referred? I don't know, but I think sometimes the danger of policy in my mind is sometimes we put the policy on the books and we think that fixes the problem, and rarely does that happen. And then the worst thing, it makes us sort of complacent, like, oh, we've checked that off the list, we've taken care of that. And I was just going to, because Jason's pretty shy, I just want to say from my perspective that what he didn't say in his report was the presence and stature that I think his presence in the dental office has really given on a national level for, you know, people have been speaking at national events, attending national events. They've gotten a significant amount of funding already and have worked really hard to do that. And I think that, you know, that's where we have really way exceeded whatever, there were no benchmarks for that, but I really think that if you're not kind of close to it, maybe it's hard to notice that and to appreciate what a boost that is for the whole work of improving oral health in this state.
You can clap for Jason again.
Yeah, true.
Kim, we have a great question for you.
I just did an interview.
I know. I was just dying for you to come back. Since the caries rate in children ages 2 to 5 is 144% higher in West Virginia, I'm not sure about these data, than the rest of the nation, and we know up to 60% can be genetic. Why is this? Lack of education, fluoride, diet, sugary drinks? We need to determine how early we can start interventions for this problem.
Well, I'm not an expert on this topic, but if I had to guess, I would say yes, 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 yes. That we do need more education. And I could refer back that Benedum has worked with some of the partners in the room to do some projects with women when they're pregnant, to try to do some education efforts. And we have a huge issue to educate the public on the role that parents play in how well their children's teeth are developed. And, you know, some of the things that we fought over the years about, like bottle mouth with babies, we thought we'd solve that. We thought we'd solve SIDS. We thought we'd solve things. They seem to cycle back around. So I think all of us that work with parents need to really exemplify what role they have, and that their role modeling of whether or not that they brush their teeth. I wish Senator Stallings was here today. He couldn't be with us because he's actually being a doctor today and he's practiced. But Senator Stallings tells a story about a parent that comes into his office, and he's working with this child, and he sees that his child has a lot of dental caries and a lot of issues in his mouth. And he's really concerned about this child. And he's says, well, I'm going to talk to the parent about what we can do. And he realizes that his parent, who's less than 50 years old, has a total set of dentures and uses spit tobacco. I believe that that's also the case, but used a tobacco product, and two of the most preventable things that we could have done here. And if I've learned anything through this project, I will give Dr. Veslecki a little plug here. Brush your teeth twice a day and floss every day. So I don't know that I answered the question, but I think, yes, all of those things are challenges that we face and that we need to have policies about.
Is this genetic, Jason?
That's a great question. There's actually some, some research being conducted by West Virginia School of Dentistry now, I believe, that shows that there is possibly a genetic link.
Does somebody in the room know the answer?
That data is very preliminary right now, and they're looking at the genetics of the bacteria that cause the caries, as well as other genetic factors. It might be true, but I don't think
Okay, we got a question coming up right now. Okay, this will probably be really scary. Okay. What is our relationship to the Delta Dental Foundation? Delta Dental Foundation?
The Dental Quest Foundation?
No, Delta Dental.
Delta Dental Foundation. Should we strengthen this relationship? I guess we should, since we don't have.
Well, I think.
Do we want to?
I think that there have been partners in the room that have received funding from the Delta Dental Foundation in the past. I actually have a friend that works for that organization, not the foundation, but for the company. So they are active in West Virginia. And yes, you're right. We should explore other funding options, and somebody should make that connection. Good point.
Okay.
So just a second, should mention that the Dental Quest Foundation, with their funding, that was how we, we're basically able to hire a full-time epidemiologist, and we're going to be hiring a dental sealant coordinator. So we definitely need to look at all our funding sources.
Well, that's our program. Let's give a round of applause to this great panel. Thank you all for coming. Well, there's Michelle Baranaskas, a new member of the State Early Childhood Council.